Welcome to a new episode of FUH Cast, a new podcast from Fakeeh University Hospital, where experts share their ideas, tips, and discussions in a very easy and understandable way. I'm Dr. Sarah Rizk, Pediatrics and Adolescent Medicine Specialist here at Fakeeh University Hospital. During our last episode about bedwetting, we received a lot of engagement from our community. There is a lot of them that asked to discuss the topic about urinary tract infection and how it's affected in school and how we can get rid of this problem, what are the main symptoms and what are the main causes and risk factors. Today I have Dr. Mazen Abush Shaban, Consultant Pediatrician and Consultant Pediatric Nephrologist here at Fakeeh University Hospital. Thank you, Dr. Mazen, for being with us today and sharing your insights and ideas about the nice topic that we're going to be discussing today.
Dr. Sarah, it's my pleasure and honor to be with you and to share this very important, nice topic. And what makes me happier also that this topic is related to the previous topic as well. Yes. Because when a child comes with bedwetting, which we have spoken about in the last episode, the first thing I look to or I look into whether the child is having urinary tract infection or not. So in a way or other, the two topics are related to each other and they should be having the same happiness and the same consideration with regard to the parents and with regards to the ones who's looking after the child.
Yes, because bedwetting as itself can also be a cause of urinary tract infection.
Yes.
And in our clinics, Dr. Mazen, I'm sure we have a lot of kids that come with pain or burning sensation while they're passing urine, fever, and many other symptoms that are related to UTI. So it's a really very frequent cause for visiting a pediatrician or a pediatric nephrologist. Now, I know that there is many different causes and many risk factors for this pediatric illness. So I would like to hear from you, what are the main risk factors that are related to the start of the school that can cause urinary tract infection in children?
Yes. Dr. Sarah, I will try to make it as easy as possible so that our mothers and fathers, they can understand it in an easy, digestible way. I mean, depending on the age, the urinary tract infection will change itself, the causes of the urinary tract infection. If we take the neonatal period, the most common causes of urinary tract infection is underlying cause of urinary tract malformation or of other malformation which is affecting the kidneys and affecting the ureter and the bladder. When we go to the infancy, it is of course the reasons might be related to the underlying causes of malformation or it might be due to hygienic causes. If we go to the children, the child, which means after the age of 2 years and 3 years, then the causes will be different. And there are too many other interesting causes actually that the child will hold. And this will bring us to the school and the school opening, that the children will hold their urine for long periods of time. They are so busy, they are busier even than the adults because they are playing, they are engaged with this one, they are engaged in this game and so on, so they don't have time to go to the washroom. And that is by itself brings the possibility of the growth of bacteria on the retained urine, which can cause urinary tract infection.
Yeah, that's true, Dr. Mazen. And I would also like to highlight, I have some patients that the parents come and tell me my child is watching TV or he's on the iPad and he just distracted and he just forgot to go to the toilet. And this by itself is a huge risk factor for urinary tract infection. I suppose the same thing is happening in schools. They are playing and distracted with other kids. So maybe like they're shy to ask that they want to go to the toilet, or they just forget to ask for this. I would like also to add something important, Dr. Mazen. At school, I'm talking about a personal experience. My daughter, sometimes she comes and I see that she's not drinking a good amount of water. So the hydration is very important and is one of the preventative measures that we as parents we should follow, and as pediatrician we should advise to do that our kids should really drink a good amount of water and stay well hydrated. In UTI, different as bedwetting, as you said, in bedwetting, males are more frequent to have bedwetting than females. What do you think here about UTI?
To be honest, it is more or less the same. But here in bedwetting, the female, in urinary tract infection, the female will have the prevalence more than the the males.
Of the anatomy.
And again, it depends on the period of life. I mean, in the neonatal, males have more. After that, the female will be having more, and so on. So it depends on the underlying causes and depends on the age distribution.
Yes.
But all in all, the female, they are the top in having urinary tract infection because of the anatomical divisions. I mean, what they do have, and because of the hygienic reasons. Also, it's very difficult for them, for the hygiene, especially the school girls. It's very difficult for them, I mean, to clean themselves properly rather than the boys, which is much easier for them to do it.
Yeah, and that's why we should explain to the parents the good way of hygiene, especially in females patients, so that in our practice we also help in preventing this UTI. So not only we need to cure the disease, we also need to work on preventive all type of diseases, and one of them is UTI. In some of the cases, as you said, we can prevent it. In some other cases, when it's related to malformations, there is another treatment and another protocols and interventions that we should follow. Dr. Mazen, do you believe in alternative medicines? I have now recently a lot of parents that come and they ask me about alternative medicines or syrups or some type of, for example, grapefruits or something to drink to decrease the UTI prevalence. What do you think about this?
Yes, of course. I believe in it 100%, doctor. I mean, and I encourage the parents to do it. That's why, I mean, when we do the urine analysis for the patient who's having any problem like frequency, like burning sensation, like so, I stress on these points. I stress on how is the pH of the urine. You know, how the pH of the urine. If the pH of the urine is, I mean, not in the normal range, if it is acidic, it means that the bacteria like the acidity of the urine, and that's why there are some types of bacteria who likes the acidic urine, and that's why they grow in it. So the simplest treatment is to alkaline the urine. You will kill the bacteria without any medication. And the opposite is correct. If the urine tends to be alkaline, we acidify the urine. And to acidify the urine or alkaline it, it is with citrus fruits and it is with so many types of fruits. But if you mean the homeopathic medication, yes, the homeopathic medication as well. I believe in it. And part of my grandchildren, they are taking homeopathic medication, and of course I encourage them. But one thing, actually, they should know to whom they go. Because homeopathic medicine is something which is a big topic. And the ones who are honest and know what they are doing, they are very few number of people, and they play with the thinking and with the brain of the parents, that they let them believe in it, although it is not that effective, and at the end they come back to us.
Yeah. That's true, Dr. Mazen. Thank you for this. It's very important to cover this topic, because now in Dubai it's very frequent to hear some parents that are following this type of treatments.